traveling in and outside the loop from Memorial to the Medical Center, giving you the money tips you need to help pad your purse. From the control room of Channel 11, in front of a live studio audience, it's Great Day Houston. And now, your host, Deborah Duncan.
Everybody, as we bring Breast Cancer Awareness Month to a close, we want to focus on the road to recovery after being diagnosed and treated. And here to tell us more is Dr. Sugene Kim from Memorial Hermann, the Woodlands Hospital, and her patient, Lisa Holt. Hi there. We've learned so much through the month here as we talked about breast cancer awareness, and one part that people don't focus on is the recovery period, long after your treatment. And so let's just go back, though, and for you, when you first got your diagnosis, how did you find it? Because a lot of us as women find great lessons in that.
I actually did the self-exam myself and found the lump. Called my primary care physician, and they got me in the next day. Had me sent over to Memorial Hermann for the testing, and sure enough, it came back stage 2.
Yeah, and when you hear that,
it's terrifying. You feel like your whole life is over with. They had to do a mastectomy.
Yeah.
And that's extremely traumatic.
Yeah, and for a lot of women, you know, it's a part of what somewhat defines us, right or wrong. And so when they have to remove them, that's kind of the thing you're thinking is you've lost a part of yourself.
Yes.
Just explain medically what that is, what that procedure is.
For the mastectomy and lumpectomy, well, depending on the cancer staging, some people may need lumpectomy, which is a portion of the breast that the surgeons have to take out, or the mastectomy depends on whether it's a large cancer or not. And depending on the staging, some people may require chemotherapy or radiation. As Lisa did, we know for sure the self-examination and the early detection is very important.
Yeah.
What is not emphasized in our community is that breast reconstruction is not taught to most of the patients. There's a big study that was done in Michigan looking at women from Detroit and LA. Only 33% of the women were told that there's an option for breast reconstruction.
They were even told that there was an option there. I think part of that is that a lot of us still think that that's the plastic surgery side of something as opposed to a cosmetic surgery, if you will, side of something, as opposed to part of the whole process of healing from breast cancer.
Exactly.
So they removed the breast, and so at what point did you realize that there were other options for you?
Well, I did talk with the surgeon that removed the breast, and then I met with another plastic surgeon. They did do an implant at the time that they removed the original breast. But my body rejected that implant. So it had to be removed, and I had to go ahead and go through chemotherapy and go for 6 months with nothing at all. And then I found Dr. Kim.
And she said, we could do something
and
here.
She took care of that real fast.
And what was it that she suggested doing that you got done?
She suggested the deep flap for me, which did work. That's where they take a donation of my own skin and reconstruct the breast.
So that way you're not rejecting it.
Right.
Correct.
There are several options for breast reconstruction. Broadly, one is implant-based reconstruction that Lisa had gotten initially, and there's a reconstruction just using your own tissue, just skin and the fat from the belly, and
I got plenty of that.
I used to.
Yeah. A little good thing happened there. It took some of that fat out. Okay.
Essentially, it's a lower belly tissue. As you know, in our 30s and 40s and 50s, we get a little ball, get a little fat deposit in the lower belly.
Yes.
And instead of doing the tummy tuck, just getting rid of the skin and the fat, we use the same tissue and transplant it to make the breast.
So how do you feel about it?
Wonderful. Absolutely wonderful.
So kind of restored some of what you...
I do. I feel like she gave me back my normal life.
What do you have to say to women? Because we know that every day, somebody right here in our community, several people are going to be diagnosed.
Do the self-exam. No matter what. Do the self-exam. Get the mammogram. I don't know that getting the mammogram will stop you from having breast cancer. It won't. But maybe it will find it early enough that you don't have to have a full-blown mastectomy.
And what do you have to say to women who are going through the treatment right now? Because that is a tough part. I know you have your beautiful hat on.
I do.
And one of the things that gets so tough is when you look in the mirror, even if you're feeling good, it reminds you that
it does. It reminds you that, you know, you had to go through it. I hope that everybody has as good a support system as I have had. I've had friends, my husband. The divorce rate for cancer patients is extremely high, but that didn't happen in my case, and it shouldn't happen in anybody's case.
Right, right. And one of the things you said in the commercial break was that the doctors were so nice.
They are. They're terrific.
All right. Thank you for sharing your story with us. Thank you for sharing that there are options out there, and hopefully more doctors will be able to say to their patients, now that you've been treated, let's go to the next step and restore, if you will.
Right.
Thank you very much. For more information, go to memorialherman.org. We'll be right back.